Hello, welcome to Lovolution Village. I've been working on a podcast all week about the healthcare crisis, and that's what I'm going to be talking about today. Because tomorrow at the Tucson Convention Center, there is a rally in support of the single-payer health program. You don't hear about this coming out of Obama's mouth because he hasn't put it on the table. But I don't know where that table is, but I do know what's happening with the people of this world, and they are crying for a single-payer health program. And that means that the government would be the one that would administer a nonprofit healthcare system. It would be everyone is in and no one is out of the system. You can think of it as universal health care. There are so many nurses and doctors that are supporting this idea. And it goes to the fundamental question of what is health. And it also looks at the priorities of the healthcare system and the values that are underneath the healthcare system. And the values right now that run the system are based on capitalism. And capitalism, we know, is a for-profit system. It is there to make money for corporations, and it supports private bank accounts. It is about getting money for your own self and your family's needs. It doesn't look at the good of the whole. Now, when you really look at who we are a fractal of the whole. There was this new mathematics that happened in the 80s called fractal mathematics. And they brought us these beautiful images of fractal geometry. If you've seen them, you know what I'm talking about, because when you go into the very small relationships, you can see each part is a part of the whole. And so it's a beautiful concept, and that's what we are. We as individuals are part of the larger society, and that society is part of the cosmos. And that cosmos, who knows, there might be other universes out there, multi-dimensional universes that we're all connected to. So that's why we need to start thinking of ourselves as fractals of the whole. And when we are a fractal of the whole, you realize that you are part of humanity. All of humanity needs to be healthy in order for you to be healthy. For example, when we breathe bad air or drink toxic water, it is outside of us. This is something that we've done to the environment. We've polluted our environment. And it's not good for the whole of humanity. And it isn't good for you as an individual either. So that's how the fractal system works. What is good for one is good for all. I wrote a book called All for Arcology and Arcology for All. Arcology, as some of you might know, is ecological architecture. It's a new design that's based on the fractal, looking at the macrocosm and the microcosm and then lining it both up so we have an ecological city design. So back to that bottom line. The bottom line in a for-profit insurance-based healthcare is profit. And profit leads to doctors becoming greedy hypocrites. Now, there are some good doctors out there, and those are the doctors who are advocating for patients' rights, and they are working so that all the world can have health care. They support the poor having equal rights as the rich and creating a classless society. Now, some people say, oh yeah, you're advocating socialized medicine. I'm advocating something that's never happened before. We've never had a social system based on the good of the whole. We haven't had a universal social system that takes care of everyone from cradle to grave. So that's what I'm talking about here, is creating something that hasn't been done before.